Hello friends, happy to see you all in this new video. Today I am going to tell something about, or we are going to begin something about this case presentation. So whenever we are going to go for a clinical posting, we have to present a case. How to properly present a case, we are going to see in this video and the subsequent videos. Before going to the exact case presentation, when you are going to be a doctor, a person is going to approach you for some problem in his body, which we call it as symptoms or complaints. So that is the problem the patient is going to have, that he is going to tell you. What is the duty of a doctor? A doctor has to find out what is the exact problem in his body. That is the main thing of a doctor. So he has to make an accurate diagnosis. Once an accurate diagnosis is made, we have to give treatment for the patient. So we have given all these three things here. Out of the three, the first thing is by the patient. The last thing, treatment, is given in the literature. They have given some protocols how to treat each diagnosis. Now you should understand, a doctor's knowledge and skill lies in making an accurate diagnosis. Let us see how to make an accurate diagnosis, how to record the diagnosis properly. Let us see how to make a proper diagnosis, how to write a proper diagnosis. A proper diagnosis should include 4 parts. These are very, very essential. If you don't have all the 4 parts in your diagnosis is incomplete and it is not accurate. Let us see what are those 4 parts. A diagnosis should have an anatomical part. Anatomical part means it should indicate which organ of the body is affected, in that particular organ which portion is affected. It has to be very accurate and precise. The next part is the pathological part. What kind of pathological disease the patient is having? It should be there in your diagnosis. Once you know what is the pathological part in this diagnosis, we should also mention about the type of the pathology, what is the stage in which this pathology is there, and what is the grading of the pathology. Some diseases will have staging, some diseases will have grading of the pathology. That should be a part of your diagnosis. Last but not the least, diagnosis should include what led to this pathology. That is the etiological component. So, a diagnosis should have all these 4 components. If any one is missing in your diagnosis, then your diagnosis is incomplete and inaccurate. Now, let us see some examples of a proper diagnosis. The first diagnosis I have written here is a right eye cortical cataract of mature stage due to senility or aging. Here I have included all the 4 components. The first is the anatomical component. The right eye is the organ affected. Cortex of the lens is the portion of the eye affected. Here I have not written it is a lens because it is understood cataract always occurs only in the lens. It is the disease of the lens of the eye. So we did not mention the lens here. Next is the cataract, which is the pathological part. The third one is, it is the staging of this cortical cataract. You know that cortical cataract has 5 stages. The 4th stage is the mature stage of cortical cataract. The last thing is the etiological part. In this particular patient, the cataract is caused by aging, that is, patient getting older and older, he naturally develops a cataract. So the etiology is due to aging process or senility. Second example for a proper diagnosis is left eye nasal pterygium of regressive stage grade 2. Here the left eye is the organ affected. Nasal portion of the conjunctiva is affected in the left eye. Here also I have not mentioned it is a conjunctiva because pterygium is a disease affecting the conjunctiva. That is why I have not mentioned it. Pterygium is the pathological part. Pterygium has types, it has staging and it has the grading also. Here the pterygium is of a regressive stage. The pterygium has stopped growing and it has started to shrink in its size. So that is why we have told it as regressive stage. It is also having a grade, that is a grade 2 here. Depending upon the amount of involvement of cornea, grading is done. So here it is a grade 2 involvement of the cornea that I have mentioned it here. It indicates the cornea is affected in this case. Here etiological part I have written nothing because pterygium, as you know, it is caused only by prolonged exposure to hot, humid, dusty atmosphere or jobs involving such a situation. So it is understood. So I have not written the etiology here. These are the two examples of a proper diagnosis. As an ophthalmologist, I have told examples about ophthalmological cases, but the same type of proper diagnosis has to be made in all patients in whichever branch of medicine or surgery doctors are going to get qualified and you are going to work there. So writing a proper diagnosis is very, very important. Let us continue with the case presentation in the subsequent videos. Thank you.